What is the difference between flexible and rigid bronchoscopy for lung cancer? Imagine trying to look inside a complex maze of tunnels in your lungs. Doctors use special tools called bronchoscopes to see and take samples from these tunnels. There are two main types of these tools, flexible and rigid bronchoscopes. Both help diagnose and stage lung cancer, but they have different designs, uses, and advantages. Flexible bronchoscopy is like having a tiny bendable camera on a thin tube. It can be inserted through your nose or mouth and gently threaded deep into the smaller branches of your airways. Because it is less invasive, most procedures are done while you're awake but relaxed, usually with intravenous sedation. This flexibility allows doctors to reach areas that are farther out in the lungs, especially the smaller, more peripheral regions. They can also use advanced imaging techniques like endobronchial ultrasound to get a clearer picture of lesions that are hard to see. During flexible bronchoscopy, tissue samples can be collected by brushing, biopsying, or washing the area. Its diagnostic accuracy for lung cancer is generally around 65 to 85%, depending on the location and technique used. It is considered safer overall, with fewer complications, but it might be limited when it comes to controlling bleeding or managing large blockages in the airways. Rigid bronchoscopy uses a larger, straight metal tube that does not bend. It is inserted only through the mouth and requires the patient to be under general anesthesia, meaning they are fully asleep. This type of bronchoscopy is less common for routine diagnosis but is very useful in specific situations. For example, when there is a large airway obstruction, or if flexible bronchoscopy does not provide enough information, rigid bronchoscopy can be the better choice. Its larger working channel allows doctors to remove bigger tumors, control bleeding more effectively, or place airway stents to keep passages open. It has a high sensitivity for central airway lesions and can speed up diagnosis in certain cases. However, because it involves more invasive procedures and general anesthesia, it carries a higher risk of complications like bleeding and requires specialized skills and equipment. To sum up, flexible bronchoscopy is like a gentle, versatile tool that can reach far into the lungs with less risk, making it the first choice for most lung cancer diagnoses. Rigid bronchoscopy is a more powerful instrument used when more extensive intervention is needed or when flexible methods are not enough. Both procedures work together to give doctors the best chance to diagnose and treat lung issues effectively. The decision on which to use depends on the location of the tumor, the patient's overall health, and what the doctor needs to accomplish. Always remember, these procedures should be performed by experienced specialists in a controlled setting, and your healthcare team will choose the best approach tailored to your specific situation. If you or someone you know is facing lung cancer testing, consult with your doctor to understand which method is most appropriate for your needs.